Hi, I'm Dr. George Northrup, and we are talking about how to overcome PTSD, which stands for post-traumatic stress disorder. The first part of that, trauma. If you've had some kind of traumatic event, usually we're talking about things like war, combat, rape, physical attack. We're talking about trauma, all right? Now, most people recover from that without tremendous sequelae, but some people have a lot of lasting scarring, for lack of a better word. And the form that takes in PTSD is, number one, often a re-experiencing phenomenon, and that's things like nightmares, flashbacks. I see one person who saw quite a bit of combat, and the smell of diesel fumes sort of triggers that person's brain into a hyper-alert state, and they feel like people are coming after them and that they have to be on guard and have trouble sleeping. So that would be one way that PTSD might manifest itself. Now, what do you do if you got PTSD, or you think you do, or you know somebody that does? Now, the first thing, see a mental health professional. This is a fairly serious condition. If you've got lasting effects after a trauma, you definitely want somebody's assistance with this. So a mental health counselor, psychiatrist, somebody. There are some forms of therapy that are useful. One is called EMDR. If you want more information about that, look it up. You're already on a computer. Cognitive behavioral therapy can be helpful. And then there's a number of medications that can be useful for some of the symptoms and the core problems of PTSD. So there's our 101 of how to cope with PTSD, or post-traumatic stress disorder. And I'm Dr. George Northrup. Thank you for watching.